Hello and welcome to another edition of Health on the Heartland. I'm Karen Blakelock, and joining me today is Dennis Johnson, the CEO and President of Hardin Memorial Hospital. Thanks for being here with us.
I'm very honored to be here. Thanks, Karen.
Well, you've been at the hospital a little over 10 months now, is that right?
That's right. It's gone by in the blink of an eye, I'll tell you.
It is. So you're really at 913 North Dixie, the hospital, and we've heard Hardin Memorial Hospital, but a lot of changes, exciting changes, are actually taking place at Hardin Memorial Hospital, and we've heard a term, Hardin Memorial Health. Explain to our viewers a little bit about that transition period that's going on right now and the new name changes.
Sure. That is exciting. Hardin Memorial Hospital historically has been around, as most of us know, since 1954, and has been historically primarily located at 913 North Dixie, but we felt like we needed to make that name change to better reflect who we are, not just geographically, but also programmatically. We're more than just a hospital. We do have some 20 plus off-campus locations in not just Hardin County, but in several of the surrounding counties as well. And also programmatically, we're doing a lot more than just inpatient hospital work. We're doing quite a bit of outpatient work. In fact, this hospital has a strong history of strong outpatient services to Hardin and the surrounding counties.
And I think that's a great point, because it's not just Hardin County. Tell us a little bit about, we're in, Bardstown, we're actually out in the Brandenburg area, and it's really those services and being able to reach the people in the surrounding areas and serve them.
Absolutely. When you're talking about outpatient care, folks want convenient, top-notch service, and by convenience, that's close to where they live. We now have a major imaging center in Brandenburg and Meade County, very, very nice, and we've got all the major imaging modalities there, MRI and CT and regular X-ray, and we're very excited about that. And we now have a major presence in Bardstown with both imaging and with laboratory services. And we're continuing to look at other markets as well where we might expand.
Very exciting, especially with the services and the teaming of physicians. We've had a lot happen recently with teaming and partnering with physicians in the community. Tell us a little bit about that.
Yes, we've got quite a few business partnerships that have been developed over the past year and a half. This is not a new phenomenon. What you're seeing nationwide, and you're seeing it particularly very strongly in the Louisville metro area, and really we're kind of part of the Louisville metro area here in Elizabethtown, is you're seeing physicians aligning with health systems. This is for many different reasons. One is it gives the health system a strategic advantage. It helps the physician because physician incomes are being threatened, and their viability is being threatened as independent practices. And together, it's one of those things that together hospitals and health systems and physicians are much stronger together than they are independent of one another. We have had quite a few partnerships develop over the past year and a half. Of course, the biggest, two of the biggest ones have been surgical specialists, the partnership with that group that has a long standing history of excellent service to this community. And then, of course, the partnership with Elizabethtown Diagnostic Imaging, which we're very excited about as well. And those are two of the bigger ones. Of course, we've had quite a few of smaller partnerships that we've developed.
And a lot of the excitement, that we're hearing, and the great news, I guess I should say, along with these relationships, is how it can enhance patient care.
No question. Together, when we're all working on the same team together, developing programs and facilities and physicians and programs and developing those together, and we can just help provide better service to our patients and our community.
We also have a lot of new physicians coming on board for different services too. For example, neurosurgery. We have a lot of family practitioners. We know there's a need in the community, and we are constantly looking at how we can expand our services in that area and provide those here in this area so people don't have to go, they're staying within their community.
Well said, and you're absolutely right. We're recruiting across all different specialties and in primary care, and we still have a ways to go in primary care, but we've got an excellent cadre of primary care physicians, and we've added to those numbers this past year. Primary care is one of those things where folks don't want to have to drive very far to go to their primary care physician. They may, they're a little more willing to drive a little further for specialist care, but not for primary care. So we're trying to develop primary care sites out in the communities and in the surrounding counties. But we're also very proud of the physicians that we've developed, the specialist physicians that we've developed over the past couple of years. And you're exactly right. We've added some just top-notch specialists over the past year or two.
Well, and it's important, I know, especially as we were talking with family practice and primary care, is that generally you're going there when you don't feel well, or these are routine visits. So you want to have it in your community so you can get back into your daily routine as quickly as you can.
Absolutely. And these folks understand that the primary care physicians that are part of our team are just excellent with relationship building, and that's the way it should be, with not just patients but with the whole family. I mean, this is you've heard us talk about our mission is to take care of patients and families, and family members are just as important, and our primary care physicians understand that, and they are integrated in their communities. They are involved with their local communities and know what's going on there. So.
We've had a lot happen with technology. We are always striving to provide the best quality there. When you walk in the doors of Hardin Memorial Hospital right now we're back to kind of the 913 North Dixie, we're seeing a lot of changes. Tell us what's going on specifically as we look at how we can better enhance our services to our customers in the emergency department.
Sure. Well, we are, I will say that in my 10 months here, I've been very impressed with the level of equipment. Two things that have impressed me: people and the commitment or equipment. We have got Hardin Memorial has as good of equipment and services like that of any hospital in the country, and especially of any hospital in the Louisville metro area or the Commonwealth. One of the things that we are in the process of doing, though, is updating our facility. We've got a little bit older facility. Our facility, the core facility, is 1954, and we've added on to ever since then, kind of like a jigsaw puzzle, and that's not unusual for hospitals, especially big hospitals like ours. But our emergency department sees 55,000 ED visits a day, which is one of the top 10 largest emergency rooms in the Commonwealth. And we're making some improvements to better accommodate that volume. We've added a new triage area. We've added a new, what we call a chair unit. These are where patients are put on a recliner instead of a gurney. And this is for more minor emergencies. That's
absolutely.
Right. That's right. And that's just been a recent thing, and that's gone in the short period of time it's been open. It's gone very well, and we're just going to be making some general facility upgrades throughout the whole facility to just better serve patients and family members and really anybody walking in our door.
Right, and again, the facility we talk about, Hardin Memorial Health, the system, in making sure that there's that continuity so that we're all working together as a team so that we can better the patient care.
That's right.
Absolutely. Now, strategically, and you talked about, when we started back in the 1950s, where is Hardin Memorial Health headed?
Sure, well, we are excited about going through a strategic planning process right now. That process, we're in the third month of that process. We will complete it next month. This has involved board members and physician leaders, community folks have been a part of that, and then hospital folks have been a part of that. We are really looking at three areas. We could kind of break it down into three different groups of areas that in a plan, really, a strategic plan is like a roadmap that gets us to where we want to go. It's where we're going to be committing time, talent, and treasure over the next 2 or 3 years to better position Hardin Memorial Health. The first area that we're looking at is in the area of facility, and I made mention of this just a moment ago, but we do have some facility needs that we've got to address, namely in the emergency department, but not limited to there. We've got some inpatient areas that are in need of updating and upgrading, and we would like to have a better mix of private rooms where we can offer more private rooms to our customers, and that's more convenient. Not just for the patients, but for the family members as well, who are with the patients. And then we're looking at just a general upgrade of facilities throughout, just some updating that we need to do, and perhaps even a medical office building. We're recruiting some very fine physicians to this community, but we've got to have a place where they can practice as well. So we're looking at all of those things, and we're even looking at some of the neighboring counties. The second area that we're looking at as part of the planning process is in the physician integration arena, and we will continue to recruit needed specialists and more primary care physicians to better serve this community. The third area is in the area that I will call service line development or programmatic development. By service lines, I'm talking about cardiology, oncology, women's and children's perhaps, the neurosciences service lines, and this is really pulling together physicians and facilities and programs, and then just better meeting the needs of customers in those service lines. So those are just some of the things that will be addressed as part of the planning process.
And part of that process too is something that we're introducing now, I know, to our staff so that we are all on board, and that term is called the art of caring. Do you want to talk a little bit about that?
Sure. Yeah, I could talk the rest of the program about that, Karen, but I know our time is short. We are we will be significantly improving the service that we provide. Many of the staff, in fact most of the staff have heard me say, both the hospital staff and the medical staff and the board, that we want to exceed the physical, emotional, and spiritual needs of 4 different customer groups. Patients first and foremost, their families, physicians, and each other. Basically anybody that's walking in our doors or any of our 20+ locations of Hardin Memorial Health, we want to provide an outstanding experience every single time. And that's what we're trying to do with the art of caring. The art of caring is just our name for a culture change, if you will. We want every interaction, whether it's a clinical experience or a non-clinical experience, we want every interaction with a patient or a family member to be an outstanding one. And so we are equipping our managers and all 1,700 employees and all 250 physicians with tools to better do that.
And I think you hit on it, because it really takes everyone, and that goes from the registration, the moment that you walk in the door, to the follow-up phone call to see how you're doing.
That's exactly right.
Because we care about who we're taking care of.
And we want to take it. We want to be one of the best hospitals in the country, and we will be.